having a little glitch there.
Thanks.
Of course, it went totally smoothly another day, but that's life. And
Did
it's
it?
so great to see you. This is Dr. Sarah Marion Lucking. I am so grateful that she's coming on and Breast Cancer Awareness Month because we've known each other for over 10 years through the University of New Mexico. And she's an alumni from there, and I also an alumni from there way back. And she recently spoke at our annual ninth Walter Bergdorf meeting, and I was just so impressed that I want to share it with the community here and hopefully with her community. And, it's just so important right now. We've been trying to offer support and to show patients that dermatology can offer a lot of support to patients as they're going through their journey through breast cancer and afterwards, many of the medications you have to be on. So welcome, and please tell us about the amazing website and research that you found going through your journey.
Yeah, so I was diagnosed with inflammatory breast cancer in March of 2022. And I am a dermatologist as well, as you said. And I was on maternity leave with our fourth son when I found my breast cancer. And inflammatory breast cancer is a little bit different because it's more aggressive than most breast cancers and it's more deadly. So I went through chemotherapy, surgery, which is a bilateral mastectomy, and then radiation. And it was quite intense. And it was a very hard time for our family. But one thing that helped get me through it was finding out about complementary and holistic health and wellness. And I made a lot of lifestyle modifications and in order to help with side effects and also to help with prevention of recurrence. And through that, I decided to create a not-for-profit website to help other people going through cancer. And on the website, I have research and evidence about different lifestyle modifications and support systems and a book list and cancer retreat information that patients can all access and tips. Going through it is hard, so it's an ordeal.
Yeah. I mean, the thing that was so amazing to me is whenever we're overwhelmed with being given a diagnosis, the first steps are just to gather information. And there can almost be too much information and you don't know where to turn to. And so I love that the thing that I love the most is you incorporated, I'm going to go through the treatment, the traditional treatment, but I want to add more.
Right.
And I was just so impressed with the concept that studies had been done to help you maybe not have as many side effects when you're going through chemo with respect to what you ate. And I think you alluded to fasting and exercise, and that just blew me away that you had found that information. Can you tell us a little bit about that? About how you approach that?
Sure. When I went through chemotherapy, the oncology team had a lot of tips and tricks to help with some of the side effects. One of the biggest ones being irritation of the mucous membranes, like sores in the mouth, or neuropathy, damage to the nerves. So you chew ice chips while you're going through chemotherapy. You're wearing these ice cold booties and mitts on your hands to prevent your nerves and your fingers and toes from being damaged. And so that is an example of how modern medicine is recognizing ways we can combat the side effects. But then, as you said, I also did some research on my own and decided to do some intermittent fasting, which is what I still continue to do today. And some studies have shown that fasting before chemotherapy can help to improve your response. And that is a little bit controversial. So if anybody's listening on chemotherapy, you definitely have to talk to your doctor first about it. But
Sure.
I wanted to let people know that this is possible and the way that our bodies work and how we can help them work even better and respond even better to the medicine. So that was one example. And then exercise is huge. It definitely helps to prevent some of the cardio or heart toxicity from some of the chemotherapies. It may help with neuropathy as well. And it also does help prevent recurrence too. And it also helps your mood because cancer is just incredibly challenging on so many levels, emotionally, spiritually, mentally, and that boost of feel-good hormones when you exercise is really, really beneficial.
Yeah, I so agree. And I think the one thing you probably observe this taking care of patients too, that it's so overwhelming that we need to be able to control the things we can control. We can't control, the diagnosis and whatever they've told us. is the most susceptible to treatment. We can make choices, and then controlling what you can control with your diet and things that help lift you up and give you more energy, I think are going to be a huge part of healing in many diseases. And I'm a huge proponent of that. It's not just about the medicine. It's about, who's in your support system. It's about who can you trust to talk to. What are the sources that, like your source that has excellent research-based information. It doesn't mean that that's the only study that's ever going to happen, but at least somebody's thinking about it. I thought you told me that even with the fasting, it seemed to be affecting the gut biome, which we know is so important, and that somehow helped you not have as much nausea going through the treatment. So that was fascinating to me.
Right.
Yeah.
Right. And so the theory is that when you're fasting, after so many hours, the gut microbiome or little bacteria in our gut sort of goes quiet and is not then taking in the chemo as much as it would be if you were actively eating and it was digesting at that time. And so that's kind of incredible to think about. And I think it's so beautiful what you said about patients taking agency over their own health, because we do feel so vulnerable and out of control when cancer just walks into your life and just disrupts everything. And it is true. I think that's a huge way to navigate it and say, like, no, this is how I'm going to do it. This is my choice to do a plant-based diet, or this is my choice to embrace my community. And we know that having a stronger support network in a community increases survival, which is amazing. We do really lift each other up.
Yes, and I've always been so proud of women in general. Women are great information sharers. We love sharing resources long before texting and Instagram and Facebook. You can ask your mother, your grandmother. We would go to our most trusted friend to ask, who would you go to? Which doctor would you go to? What did you do? But everybody's story is unique. So we have to also take advice with a grain of salt and kind of, lean into it. I've had colleagues and friends who really didn't want anybody to know until they got farther along in their treatment. I've had others that want to tell everybody because they want it to be, share and help make sure people are getting screened with a mammogram or, say it was something to do with a pap smear. But then I think the other part I'm realizing is we're walking along and there's so many women that now have had breast cancer and now are dealing with medications that they have to take afterwards, whether it's the anti-estrogens, whether they've had to have a hysterectomy. And there are a lot of changes that go on in your body, your hair, and your nails. And that's where I think your dermatologist can help you navigate some of those things. We talked to Dr. Galeria, who was the co-creator of Inner Glow vitamins, and we talked a little bit about how those vitamins can be supportive later. And both of us agree we're not a fan of you suddenly doing a bunch of supplements and doing things without consulting your oncologist, because you don't want to ever do anything that could affect or diminish the effect of the most important treatment time period. Would you agree, Dr. Lucky?
Absolutely. There is actually a really good resource that you can search supplements and herbs and vitamins through Memorial Sloan Kettering. And every time I go on there, I'm amazed at how much they have listed, but also all the interactions that can occur. So I really personally, and when I was practicing for my patients too, I'd be cautious about supplements and herbs because they are powerful. Plants are powerful. One of my chemotherapies is derived from a tree. And so think about that power, like that tree had the power to kill my cancer cells. Let's be kind of cautious, but I'm also hopeful that one day we will have the information that we will know which herbs and which microbiome is best for your cancer and how to treat it.
Absolutely. I feel like we're really on the cusp of that with so many things, with
Mhm.
psoriasis, with eczema. That they're doing a lot of microbiome studies. And, thank goodness that all these things are going to overlap and help us in many conditions. And I know one of the things I've seen over the years is when people lose their hair, sometimes they would have tenderness and breakouts and sort of what we call folliculitis, almost like little pimples develop, and it would make it hard for them to wear a wig. So, we would sometimes find ways to calm those symptoms. I think the other thing I've just really seen is that we need to continue to give people support, even if it's been a year, 2 years, 3 years. It's always lurking in the back of your mind when you've had cancer. And so it's an important thing for physicians and all clinicians to just be sensitive to that they're not just there for the wart on their finger, that it's an important time to reach out and say, how are you feeling about that? Where are you with your follow up? How often do you have to follow up? And how's it affected your family? I know we don't always have the time to ask these questions, but it doesn't take that much time to really listen and ask a few important questions.
Right. And I think you have such a beautiful relationship with your patients. And when that patient care and trust is there, patients will, feel like they have you in their corner, and then also tell and share things with you. Like, oh, I do have this rash. And what do you think it could be? Could it be my medicine? Could it be the cancer's come back? Because that's really what's going on in the back of our minds, right? That's the big
Exactly.
question, the elephant in the room, if you will, because nobody wants to have cancer and no one wants to have it come back.
Exactly. And then now we know, we're learning more and more. There's so many experts across the country that are delving into hormones and menopause, and the concept that many times with breast cancer, you're immediately put into menopause overnight. And so I think we're going to learn more about what's susceptible. They're starting some studies about that vaginal estrogen is okay, people still can do that even if they've had breast cancer, and it'll help them with discomfort and things like that, we thought it was an all or none before. The more women, I think, that are involved in these research projects, we're also seeing, some interesting studies that are going to help people, not just when you're in that time going through treatment, but afterwards. And it's I've just seen it changes people, and it changes how you look at the world. I know you've talked about meditation. People are always saying, oh, go do yoga and meditation. I go, yeah, let me put that on my list. But when someone actually takes you through doing some meditation, if you've ever been in a session at a meeting or someone's inviting you, it is life changing. It is changing how you feel. Did you do that also? Did you try to incorporate some meditation into your day-to-day life?
I did. And at first it was very hard for me. I
Yeah.
think there just were so many things, we have 4 kids. So it's like, what is the list of things to do today? But one of the silver linings or blessings of cancer is that it really changes your perspective, and you do really see what's important in your life. And I just felt like I needed to press pause, and I did try meditation, and I still use meditative practices today, and other things like sound healing, and I think yoga is very helpful as well too, and other complementary healing modalities too, like Reiki and acupuncture. All of these have a place, and I think that we're beginning to recognize it more.
Yeah, and I think we don't have to be all or none. I think there was a phase in my career where people would say, I don't believe in, Western medicine. I only believe in Eastern medicine. I only believe in natural. Well, there's natural, like you said, plant-based, even in the drugs that, and that's where they were derived from. So I think that we have to be open to bringing things together for the healing. And I used to think meditation meant this was a nice, quiet place I could make a list of all the things I needed to do. And then I thought, oh, you're not supposed to do that.
Hmm.
And then I remember people saying, which I think is helpful, they would say, let the thoughts come into your head and then let them flow across like a cloud, like on a cloud, just flow across. You're going, I'm so behind. I don't know where my kid's baseball game is. Just let it flow across. And you could just feel it. And I remember even thinking one time, and everybody has different spirituality, like saying, oh my God, this list is too long in my life. And turning in the middle of the night and saying, okay, God, you be in charge of the interest rates, because I really don't know anything about that. And I say that in a funny, joking way, but I think there is this feeling we always think we're in way too much control. And it's a period of time where you're losing control, but I think control the things we can
Right.
add, like you said, the diet, taking a walk. If you can't run, if you can't go to your exercise class, maybe you can still go to your exercise class and just participate for a little while and be
Right.
with community. Um, so I'm really impressed. I mean, I'm just so grateful that you took the time to create this site. We're going to list it in the, we'll list it and we'll also list the other resources you said about the vitamins because I
Thank you.
think knowledge is power. Mhm.
Yeah, and I think too that, like you said, like even simple things are ways to take control, like just going out into nature or calling a friend, or even breathing. A lot of us breathe in a very, like up in our upper chest, and if we really just relax and breathe into our bellies through our nose, that's a very simple way to start that kind of calming meditative practice. Like you said, it's little simple things. It doesn't have to be a huge, like an hour of meditation, which is just whew, way too overwhelming for me, but. Thank you. Thank you so much for letting me share my experience. And I really hope that we can shine a light on breast cancer awareness and also some tools for prevention and early screening too.
Absolutely. Yeah, and please keep adding to your site because I think it's just the beginning of something wonderful that, it could really make such an impact in so many people. And let's try to talk again. So thank you so
Thank
much.
you. Thank you so
Have a
much.
wonderful
You
day.
too.
Bye-bye. And it's called Health Through Cancer, right? Is the
Correct.
name of the site. And I'll
Healththroughcancer.com.
put the link in the bottom there for you. So take care. Bye.